Hi, my name is Dr. Sayyeda Amna Mahmood. Today I select the topic of fetal echocardiography, and I just see a very good findings for just a small. If you have to be scan a fetal echo to fetal heart, and then you have to very easily to diagnose. So I just make the topic by differential findings how you can make easy diagnosis in fetal heart. So first we have to be scanned for the fetus. So we are going from the view of the transverse views of the abdomen, the upper abdomen. So we can see the stomach and spine, and then we have to be exclude from the which side of the baby is right and left. Now if you see the stomach from the right or left, you have to exclude it, so then you can easily exclude it these findings which you can find. If you find, so it is the fetal heart something going to be abnormal, like abnormal position of the liver or the stomach. You see the spleen, asplenia, absence of the spleen or the polysplenia, aorta, or and the inferior vena cava on the same side. So aorta, inferior vena cava, same side means there is a something will be going on, and interruption of the inferior vena cava, that is also with a sign of fetal heart abnormality. Then you have to see the four chamber view. Four chamber views is very important view of the fetal heart. So if we have see the four chamber view, the normal four chamber view, we have the mitral valve, tricuspid valve, interventricular septum, foramen oval, the wall of the heart, and the pulmonary veins. But if we saw the position of the heart is not on the same side of the stomach, or from the left to right have to change, so you can exclude the dextrocardia or mesocardia. You see the size is cardiomegaly. If size is, you see the cardiac circumference and the chest circumference of the baby heart, and then you feel is more than 0.5, so it means a increase size of the heart. The asymmetry side of the chambers, so it is also the finding of the abnormal heart. Atrial ventricular septal defect, to crossing in the Doppler you can see the flow around it, and without Doppler you can see the gap between the interventricular septum, like this is interventricular septum, you see the gap. Atypical displacement of the septal leaflet of the tricuspid or mitral valve, both you have to see the, this is the level of the valves. If you see the level of the valves are starting here or starting upper, so you also finding this is a something going on. Now we have to exclude the three vessel view. Then what is the three vessels view? You have to see the three vessels for the superior vena cava, ascending aorta, and the pulmonary artery. These three vessels views are very important. Three vessel tracheal view. So if you see anything for in this, it like the dilatation of aorta, pulmonary artery, or superior vena cava, it means there is something abnormal. Two arteries begin small and one artery is large, or the abnormal vessels alignment means is to interior or posterior movements. Arrangement of the vessels, one vessels are absent, only two vessels you can see, or additional any other vessels you can see, or ascending aorta you can see around it. So this is the abnormal heart. Now the right and left outflows, ventricle outflows, you can see both of right and left ventricle outflows. So what is the finding of that in this? Ventricular septal defect, overriding of aorta or pulmonary arteries to each other, abnormal ventricular arterial connection, transposition of the great vessels, double outlet right or either the left of the ventricle, or single arterial trunk or single outlet, abnormal dimensions of outflows, or semi-neunal valve, only one valve having. This is the normal right outflow, which have the starting of the after the valves, the pulmonary veins, and this is the right atrium and right ventricle, and this is the left outflow, the normal left outflow, which is arises from the left ventricular to going into the septum of the aorta, and this is the ascending aorta and going for descending aorta. So this is the aorta, so this is the normal left outflow. Now we have to see the another point, which is to indicate the abnormal heart is the aortic arch. So first you have to see the aortic arch. Aortic arch is a descending aorta, ascending aorta, dividing branches. If it is going from the same or arising from the ascending aorta, the branches is mean is going, everything is good. But ascending aorta is being smaller than the descending aorta, it means some narrowing is there or ductus problem. Ductus arteriosus, focal diffuse or narrowing aortic arch, interrupt of aortic arch, or double aortic arch. You can find the double aortic arch also. Now the another things is in this point, the abnormal 3 vessel view, congenital heart disease group 1 is abnormal vessels of ascending aorta or large pulmonary arteries. This is the normal pulmonary veins or pulmonary arteries. Pulmonary arteries. Normally pulmonary arteries are here from the left or right, and this is the right atrium, pulmonary artery. The right divided into the right and left branches, and this is indicated what? If it is not early branches, if it is branching from not from the right side, so coarctation of aorta, interruption of the aortic arch, aortic atresia is possible, or the left out syndrome, hypoplastic left out syndrome is possible. If the small ascending aorta and large pulmonary artery, you remember. Now, what is the another thing? The small pulmonary artery and large ascending aorta. So why the large? Large means in something is narrowing, or something is will be displaced, or something will be to stenosis. So the tetralogy of Fallot, like the origin of the vessels are not good. The pulmonary atresia with the VSD, the atresia with interventricular septum abnormality or interventricular septum disease, or Epstein abnormality, the mass abnormality, there is in a heart something dilatation of the right heart. Or so now the dilatation of the main pulmonary artery. The main pulmonary artery from this is the main pulmonary artery. So pulmonary artery, why is dilated? So it means there is any regurgitation or stenosis is here. So that's why it's the main pulmonary artery is behind, is dilated. What is the dilatation of the ascending aorta? Dilated ascending aorta. So what's the reason? If it is dilated, it means there is narrowing and something will be, or something happening from the back or throat. So if there is any stenosis or regurgitation, this is the dilatation of the ascending aorta. Now the another point, this is another point of the dilated superior vena cava. If superior vena cava dilated, so it means there is giving us some extra branch, like if it is give the persistent opening of the superior vena cava. This is, you see here, the superior vena cava, aorta and pulmonary, but here is an extra branch. So this is also persistent open, that is, or maybe there is a finding some extra vessels, which is like extra branch or azygous vein, which is also the extra branch of the superior vena cava. The interruption of the inferior vena cava with azygous continuation or right-sided heart failure is a diagnosis. So second group is also shows the alignment. Alignment means arrange, like is interior posterior movement of the vessels. So interior displacement of aorta with a small main pulmonary artery. The pulmonary artery is small and the aorta will be displaced interiorly. So what can be, you can suggest? It means something will be the vessels abnormal arrangement, or something will be happening with the vessels. So like the tetralogy of Fallot and double outlet of the right ventricle, with subpulmonary stenosis. This is a picture of the normal findings of the vessels, which we have to see the three vessel tracheal view to the superior vena cava, ductus arteriosus and aortic arch, and this is the arrangement of the vessels. So this is just I select the picture for to show the normal arrangement. Now the second alignment is by side relationship of the same arterial site. If you see the same arterial site, it means the aorta is dilated. So what will be happen? It is TGC, like a transposition of the great vessels, or double outlet in the right ventricles. I just like this with the right aortic arch to see you the not the V sign. This is a U sign and trachea in between them, or esophagus. So this is a good picture for to diagnose of the right aortic arch. Another is side by side relationship of the small aorta. With the small aorta will be happening to just to think about it, the aorta. So it means the aorta is origin is abnormal, or either the something will be stenosis. So the double outlet of right ventricle or TGC of the subaortic with subaortic stenosis. So you have to be suggest like that. You just think about it. This is small finding if you find. Now you see the other third group is the arrangement. Arrangement of the vessels is how the arrange. So you can see here the right interior aorta. If you think about it, the interior is moved from the right side. So what will be happen? Same, the TGC, the transposition of the vessels, and the double outlet of the right ventricle. I just select this picture to show you the arrangement of the position of the right three vessel view of the normal and the abnormal position of the trachea to relationship the abnormal ductus arteriosus and aortic arch relationship. So you can easily diagnose the right aortic arch. So because the aorta is moved towards the right. So this is just the finding of this picture to have to explain. So this one by one, the picture A is also show the normal. Picture B, the right side, the aortic arch is joining from the aortic arch, and C is a right sided aortic arch joined to the right duct. This is the C, and sorry, where is the D? Right sided aortic arch joining to the right ductus. Demonstrate the V sign appears, but the right side, the trachea, rather than the left side. So it is opposite direction. So it is showing the right aortic arch. And the last one is this one. This is trachea. This is the abdominal arrangement in between them. This is the finding of the abnormal right aortic arch. Now this is the left side movement of the interior aorta. The same, the left side is the left double inlet of the ventricle or double outlet of the right ventricle. So right ventricle have the double outlet if right aorta is moving interior, or inlet of the left ventricle arrangement or TGC. The transposition of the great vessels is also not good. Now we have to be see this picture, the coarctation of aorta. So you can easily see the aorta is hypoplastic than the pulmonary artery, and there is a superior vena cava or persistence there, and there is hypoplastic aortic arch which is very small, narrowing, and ductus arteriosus and pulmonary artery you can see the normal side, and but the superior vena cava is having another persistent branch. So this is also the finding which you can see that is abnormal. Now the left side is superior vena cava. So left side is superior vena cava is mean there is some venous problem, and we have to see the interruption of the venous system from superior vena cava to inferior vena cava, and we can see the ductus arteriosus abnormalities, and so you can always exclude the arrangement, the three vessel views, superior vena cava, aorta, and pulmonary artery, and ductus arteriosus. You always remember the ductus arteriosus, but that case you can find the extra vessels, which is maybe the azygous vein. And the one artery, of course, the one artery you have the stenosis or something atresia there, like the aorta, and pulmonary artery atresia with VSD, and absent main proper pulmonary arteries. This is just, I select the normal pictures of the left outflow, and you can see the aortic root. This is right ventricle, right atrium. This is the left ventricle going to the left outflow and the left atrium. So now we can see the another abnormal of the vessels number is 2 superior vena cava. That is also the bilateral superior vena cava problem. So you can know the venous system is defects. So these four groups you can easily just to exclude it, and when you excluded these findings, then you can just know about group by group, and then you exclude your diagnosis. So your diagnosis is very easy, depend upon just a small findings in fetal echo. Thank you so much.